Cancer Council in New South Wales acknowledges the traditional custodians, both past and present, of the lands on which we live and work. Welcome to you all. My name is Jill Mills and tonight we'll be discussing the subject of fatigue. So we've had many registrations tonight, so I hope a lot of the people that have registered are online and ready to hear what we've got to say. So first of all, a little bit of housekeeping. If you have any technical problems, you'll see in the chat box there's a 1-800 number to call. So call that number if you need to get help with the audio or whatever things that might come along. So we encourage you to use that chat box. If you've got any questions you want to ask, if you want to chat with other people that are on there, share what you've been through or what you're thinking. Don't worry too much if you get distracted by the chat box because we'll send you a copy of the webinar, email it to you and you can watch it later. So I guess also if at any stage you need to speak to somebody urgently, don't hesitate to call a Lifeline counsellor on 13 11 14. So we'll get into it, so let's get started and I'd like to introduce our panel. So sitting next to me is Nikki, Hariana and Carolina. So welcome to you all.
Thank you.
And I will pass the mouse over to Nikki. So I'm just going to click through onto the first slide. So we've got a lot to get through tonight, so over to you, Nikki, and thank you.
Thanks. A few weeks ago, I saw this graphic from Emma Markozic on the Sydney Breast Cancer Foundation's Instagram. I thought it would be great to get some t-shirts made up, so I don't have to keep explaining that I'm tired all the time. Having said that, that's what I'm here to do, so here goes. I'm going to speak about my story and how I got to a post-cancer fatigue diagnosis, and then a little bit on my symptoms, and finish off with some recommendations and tips. I just want to make it clear that this is my personal story, and I'm not an expert in this area, so it's all very subjective. Although I have been through both Hariana's and Carolina's programs, so there'll be some overlap. I was diagnosed in January 2011 while I was in the UK. I was about a third way into my PhD studies. I decided to stay in the UK to have my treatment, as I was told by my oncologist that while it would be tough, I would have a year out for treatment and then I should be able to continue with my life on as before. And I thought, great, I can tough it out for a year and then get on with my studies as if nothing had happened. And the reason why I'm speaking here today is that of course things did not go to plan as my oncologist had predicted, and my life has been on a different trajectory since diagnosis. I started experiencing fatigue from the first round of chemo. I thought this was all okay and normal as the brochures kept on referring to fatigue, but without going into any great detail about exactly what it was. I thought it was just a general feeling of tiredness and I kind of dismissed it, as of course you'd be feeling tired from treatment. But as I was to discover, fatigue would end up affecting my whole life. With each subsequent round of chemo, the fatigue kept on getting worse, as I'm sure a lot of you know. And like me, you've probably all tried to push through it. On my good days, I would walk until I was exhausted. I managed to attend most of my uni seminars for that year, and I continued with some part-time teaching. But once my active treatment year was over, I expected things would go back to normal. I started trying to get back into my studies, but was finding it enormously difficult and wasn't improving that much physically. I had a small lift to my energy levels about 3 months after my last radiation, and I thought I was on an upward trajectory of getting better. But that ended up being it, and my energy levels basically plateaued. I joined a gym to try to increase my fitness levels, thinking this was the problem after spending a year on the couch, but I would work out hard on one day and spend the next 3 or 4 days in bed, totally and utterly exhausted. So then I'd start to feel a bit better and think it was time to hit the gym again, only to repeat the same cycle. I tried to write and submit a coherent paper to my supervisor, but I ended up just handing in a bunch of notes with no thread or through-line argument. I couldn't make any headway through the material I was reading. I was constantly rereading it, and none of it stuck in my head. I saw a couple of the oncologists at my hospital, and they stared blankly at me when I told them I couldn't get back to my previous life. They said that all of the drugs treatment that had caused the fatigue would be out of my system after 3 or 4 months, which explained my little energy left, and that I should be back to normal. I felt their exasperation with me. What was I complaining about? I was one of the lucky ones, as I was successfully treated for my cancer and was out the other side. No advice, suggested treatment or solution was given. I was left hanging out there on my own, feeling desperately inadequate and that I was to blame, as if I had somehow caused this to happen and it's all somehow my fault. A feeling I've still been unable to shake even to this day. I decided to come back to Sydney about 9 months after my treatment, and soon after I arrived I went to my GP, still thinking my fitness levels were at fault, and said I needed to get some help, as I was still crashing and burning after working out and had problems with shortness of breath. My GP referred me on to the Uni of New South Wales Lifestyle Clinic, thinking they would provide an exercise program for me. I still had no idea that what I was experiencing was ongoing fatigue. Anyway, for me it seems it was by accident that within the Lifestyle Clinic there was a fatigue clinic, and this is where I ended up. It was a hallelujah moment. Everything started making sense. The fact that I had physical as well as cognitive symptoms and emotional issues. The fact that I had physical, oh sorry, I just read that again. The fact that despite how hard I tried to exercise, it would only make things worse and not better. I was in what they call a boom and bust cycle. On the days I would feel okay, I would work out, boom, only to crash, bust for the next few days. Carolina will go into detail about what the fatigue clinic protocols are, so I won't spend too much time discussing them, but just to say that they really do work, and it changed my whole understanding of what I was going through. A few months later, I also accidentally happened upon the complementary therapies department at the Chris O'Brien Lifehouse. They offer a range of therapies including acupuncture, oncology, massage, which I highly recommend, and classes in yoga, qigong and meditation. For those of you who can get to Camperdown easily, it's a good place to try out a few different complementary therapies which might work for you. And before I speak about my strategies for how to combat fatigue, I'd like to spend a few minutes articulating some of the symptoms I've experienced, because all joking aside, we're not simply talking about being tired in the everyday sense of the word. I won't necessarily talk about each symptom in detail, but will focus on the ones that are the most distressing to me. I wake up every morning without feeling like I've had a good sleep. I never feel refreshed or replenished from sleep, no matter how many hours or whatever good sleeping pattern I'm in. One of the most debilitating things for me is that my head feels very heavy on my neck. It's as if there's something weighing or pressing down on it, and I get tired simply from just keeping it upright. So I find lying down with my head propped up on pillows the most comfortable. And now, even 5 years on, I still spend most of my time in bed or lying down. I tend to go out for only a couple of hours during the day. As well as the physical exhaustion, my brain is definitely scrambled. My memory and words, my vocabulary, which was previously my strong point, now fail me. I have difficulty keeping track of conversations, particularly with people in a group situation, and I find it difficult to follow books and TV shows, especially the news, where multiple bits of information are flying at you thick and fast. With time, some things are slowly coming back, but the one I have most difficulty with, and it seems is the last thing to come back, is holding multiple pieces of information in my head, which affects my decision-making abilities. And I'm still unable to focus or split my focus, or multitask as I could previously. But by far the most upsetting and worrying thing for me is that I feel as though the cancer and the fatigue have changed who I was, and this has been the most difficult thing to come to terms with. It's as though I've had a personality transplant. The things that I had prided myself on before or shaped the person I was, like having a good memory, being a high achiever and thriving on stress, socialising a lot, can no longer apply to my life. Managing the expectations of what I can achieve has also been a huge adjustment. I still expect the best of myself, and I'm super frustrated that I cannot work myself out of this problem. The longer it goes on, in some ways the worse I feel, as I am further away from the life I once had. And I worry about the future a lot. But having said that, I have a different life now, and I'm making headway with other things and trying not to ruminate on the things I can't change right now. It's important to note that every activity, be it physical, cognitive or emotional, will impact on your energy levels. After cancer or with fatigue, you are already operating on a petrol tank that is maybe a half or a quarter tank full. Every time you go for a walk, stand up and make dinner, have a conversation with someone, this will drain you of your already depleted energy levels. These symptoms overlap and intertwine, so sometimes you can't separate out what may be a physical or emotional thing, as one impacts the other. Because this is a complex condition, I think it requires a multifaceted approach to combat it. If you are not near somewhere like the Fatigue Clinic or Lifehouse's living room, which allows for this kind of approach, you may need to design your own one, be your own case manager in effect, to ensure you're dealing with your symptoms. I know you're tired and that is probably the last thing you feel like doing, but thinking about your fatigue differently and making some small changes can have a big impact. You can start off small, then add things as you are able to. And you will be pleased to hear that the first thing I recommend is to relax. I can't work out if this point is obvious or counterintuitive, but the more relaxed I feel, the more energy I have, and I can think clearly and I'm better emotionally. I don't think it matters what you choose to do to make you relax, but whatever works for you, something that slows everything down, perhaps painting, mindfulness practice, gazing at the ocean, soaking in a bath. It can be anything and a range of these things, but it helps if it becomes a part of your daily life. For me, it is yoga. I find that yoga is a special kind of activity because it tackles all three categories of my symptoms. Now, I'm not talking about that type of yoga where you're forced to do certain positions and it's all very fast-paced and competitive. I'm talking about what is called yoga therapy or restorative yoga. I'm not a particularly flexible or new agey person, but I started yoga at the Lifehouse in 2013, hoping to get myself moving physically again. And after about 6 weeks, I noticed that as well as helping with my muscular aches and pains, it was lifting my mood and clearing my mind. I've continued on with classes ever since, and it has made a huge difference to my life and in being able to manage the fatigue. But it's most important that you make sure you find a practitioner that's really focused on yoga as therapy. Don't just sign up for any ordinary beginner's class. I'll provide some info on where you can find a yoga therapist at the end of this presentation. If there isn't someone in your area, then just try a restorative class. And my rule of thumb is, if you don't feel relaxed or uplifted or less burdened by a class, then it is probably not for you at this time. If that's all still a bit too new agey for you, then the number one thing I got from the Fatigue Clinic is to pace out your week and insert breaks within each day and within your week. If you only take one thing away from this webinar, in my opinion, this would be it. It is a deceptively simple strategy, but the benefits are exponential. I would also recommend seeing a psychologist to help you with any emotional issues you may be experiencing, and this one is obvious. The lower your mood, the more pronounced the fatigue is, and the worse your fatigue is, the lower your mood is, and it spirals down from there. It is helpful to have somebody on your side and keep you positive. It also keeps me on track with how I'm managing my fatigue. If I do get overtired or I've taken too much on, then that also causes a whirlwind where I can't seem to make good decisions about taking breaks and managing the fatigue, and my world ends up feeling like this. So I thought I'd just spend the last couple of minutes on how I manage my fatigue day to day in order to avoid this situation. This is my daily survival kit: my diary, my relaxation music and headphones, my eye bag, the ones with the seeds in it, a step counter, and endless cups of tea. My diary is an absolute must. I write down all my lists of things I need to do and remember, and I keep referring back to it all the time so I don't have to hold that information in my head. I prioritise the things that need doing in a particular week, and I've severely pared down what I can do. I plan my week, spacing out each activity, leaving lots of downtime in between. The Fatigue Clinic calls this macro pacing. I usually schedule my week by having one day on and one day off. So my on days are just one major activity, something like a doctor's appointment or a lunch with a friend. My off days involve staying at home doing small tasks around the house and perhaps going out for a short walk. I hardly have any activities at night, as this severely impacts what I can do the next day. If I do have a dinner on, then I plan not to have anything too strenuous to do in the days leading up to that night out to conserve energy, and I will limit the activities I do in the few days after that to recuperate. I also micro-pace each day. I try to take breaks before and after any activity. This is what I would do for a typical doctor's appointment, and it works for most other activities. But even on my off days between each activity I am doing, like cooking dinner, I will take breaks. I use my eye bag at least 3 or 4 times every day. Sometimes a break can be just having a cup of tea without any screens or anything stimulating on. And what I'm trying to do by this is not to get overwhelmed or overly stimulated, as this makes the fatigue much, much worse. Also, I still assess each day depending on how I'm feeling. I try to have one goal only to achieve each day. But if I'm not great fatigue-wise, then I will eliminate all unnecessary things around that goal, or I may need to eliminate that goal altogether depending on what it is. Very often the goal is not to do anything that day, just rest and top up my energy levels. Throughout each day I keep an eye on my step count and keep checking in with how my fatigue is going. I don't always get the balance right, and sometimes I do things that I know will be fatiguing, but that's life. I just know that I'll pay for it and compensate for it afterwards. I need to be flexible with what I can achieve, and if it takes me longer to do something, then I have to accept that. I chip away at the things I need to do a little at a time rather than in one big chunk. It is frustrating having to stop for breaks, but it works out as much, much better than just powering through. And one final thing, be patient and kind to yourself, and hopefully with time things will improve. Thank you.
Thank you, Nikki. That was great. And just looking at the chat box, there's a lot of people saying, that's me, I can relate, and asking. There's some few questions coming up that we'll get into as we move along. But yeah, so Harriana, over to you.
Thank you. Thank you, Jill.
Great.
Oh, hello. What am I doing?
So just click on the slide itself. That's it.
There we go.
And these are the resources. Yes.
We can go back to that.
Just give me the mouse and we'll just have a quick look. But these resources that Nikki's put on here, I'll just click back to it because we will share these with everybody. Obviously you can't click the links on your screen right now, but it's some interesting places I guess you've been and have helped you.
Yeah.
And I guess not everybody lives in Sydney, but often other areas have similar places. But we'll share that with you.
Yeah, the yoga therapists are Australia-wide.
Yeah. So, okay. Oh no! We've just lost our slide.
Because you
Because I clicked on the link. Okay.
Sorry.
That's
Go up to
right.
the
Is it in the other tab?
Yeah. Go to the other tab.
There we go.
Okay. Beautiful. Sorry. Okay. Harriana. Here you go.
Thank you.
Sorry about that.
I just have to thank Nikki for setting that up so beautifully because she's really told the story about what it's like to live with cancer-related fatigue. And I think I almost, after I'd sort of looked through your slides earlier today, was going, oh, I really don't need to say anything because you've just explained it all, you know, exactly the diagnostic criteria and the strategies that people talk about and things like that. So it's very much, I think, the experience that lots of people have. So thank you for doing that and sharing so beautifully and eloquently what it's been like living through that. So one of the things that I wanted to pick up on, partly based on what Nikki had talked about, was really this concept of symptom clusters. So when we talk about symptom clusters, we're talking about a whole range of symptoms or side effects or experiences that can co-occur with people. And what tends to happen is that we can identify people with some clusters of symptoms or symptom clusters that may require intervention at different levels or for different symptoms within that at different times. So one of the symptom clusters that's really been recognised fairly recently in cancer patients is the psychoneurological symptom cluster, which is really talking, as you so eloquently described, the depressed mood, cognitive disturbance, fatigue, insomnia and pain. So people will be reporting a number of those sorts of symptoms at the same time and in conjunction with one another. So that happens a lot. Sorry. Not very smooth today. So I'm not going to go through this in a lot of detail because I think you can maybe come back to it in the, and look at it later on. But it's really just to sort of highlight that what we're talking about here are the experiences of symptoms within someone's life, and they're interrelated, and that they actually have meaning for people and affect your spiritual or existential way of coping and well-being and those kinds of things. And there are a number of different things that lead into that and relate to those symptoms. And then there are a whole lot of behavioural or adjustment activities that are a consequence of those symptoms co-occurring. So really that's just kind of to set you up as to some of the ways that we think about addressing symptom clusters or things like fatigue. So looking at all of the aspects of someone's health, their lifestyle and the symptoms they're experiencing and different parts of their life that they may be able to intervene and change things to try and manage or cope with that better or hopefully actually improve over time. So I won't read through this in detail as well, but there is a clear definition for cancer-related fatigue. One of the things that I would say is really important to understand, and it's one of the reasons I think that it's probably somewhat under-recognised within the health professions and the health professionals, is that it's a subjective experience. So we can't do a blood test to say that you've got cancer-related fatigue. And that makes it really challenging for our health system because we're very much driven by diagnosis and treating a particular problem. So, and I've kind of put there the caveat that we don't have a blood test for it at the moment, but maybe one day we will be able to actually diagnose it in a more effective way or a way that's more obvious to other people, I think is probably the point that I'm trying to make. So how do we assess cancer-related fatigue? It's really done by self-report. So there are several different measures that have been developed to do this and they range from a single item question that might just be how fatigued do you feel on a scale from 0 to 10, where 10 might be the worst fatigue you can imagine and 0 might be no fatigue at all. And other questionnaires or assessment tools will ask about the multiple dimensions or components of fatigue, and they might look at how severely fatigued you feel, how long it's been that you've felt fatigued, how much interference there is from the fatigue with the activities that you're doing in your lifestyle, whether or not there's mental and physical fatigue and emotional fatigue. So all of those factors can be asked about to try and come up with this diagnosis of cancer-related fatigue. And just thought it was worth pointing out that the clinical syndrome of cancer-related fatigue was really only formally diagnosed in 1998, which in kind of research terms is really not very long ago. So we haven't kind of been working very clearly in this context for terribly long. But that diagnosis or that diagnostic criteria were really an attempt to try and distinguish cancer-related fatigue from fatigue that was related to depression, which everybody kind of expected would happen in people who'd been diagnosed with cancer, that obviously if you had a cancer diagnosis you would develop some depression at some level, and how severe that was really dependent on lots of other things about your cancer diagnosis. But we know that there are lots of other reasons that people feel fatigued, not just as a consequence of depression, and you can live quite happily with cancer in some instances. So depression is not expected, and it certainly can be dealt with if it occurs. So one of the things that I wanted to sort of pick up on is what is the cause of cancer-related fatigue, and the short answer is we're not really sure, unfortunately. So there's a lot of, this is an area of active research. There are lots of studies going on in this area to try and understand it more clearly. But it does look like there may be some component of an inflammation response. So in the body there are inflammatory markers. You might have heard of something called C-reactive protein, which might be on one of the blood tests that you would have fairly commonly going through treatment, or things like cytokines. So there are pro-inflammatory cytokines that promote inflammation and others that decrease it. And they have different roles in the body at different times. And it's essentially a very complicated thing that I don't understand because I'm a behavioural scientist, not a laboratory scientist. But one of the things that we've kind of come to understand is that there is this concept of sickness behaviour, and that in a normal inflammation response. So when you've got a flu or a cold or some infectious disease, the sickness behaviour, which is kind of caused by the cytokines, is really designed to motivate you to change what you're doing, to decrease the activity so that you're engaged in so that you can recover and prevent you spreading your disease to anybody else, because all you want to do is stay at home. So if you've got an infection or a virus, that's a really effective way for the human system to cope with it. But if you've got an inflammatory response that's caused by something else that kind of hangs around, that's really not very helpful. And so that may be one of the things that's going on. And there's certainly some idea that within the brain there are it's sort of a cyclical response where we've got different responses, and certainly the tumour cell, different treatments feeding into the system as well that induce cytokine changes that impact on the brain. So it's kind of complex, and as I said, it's a cycle that seems to be occurring in people, but again, it's not something that we understand terribly well. The other thing that's kind of becoming clearer is that there is a role of inflammation in some cancers, and maybe a lot more than we understand. So the purpose of this picture is not for me to explain that to you, but just to say that this is a really complex area, and we don't necessarily understand how these things are playing out across lots of different tumour groups. But we do know that there is data to suggest that inflammatory markers are playing a role in the development of some tumours, and sort of controlling that and doing things to moderate your inflammatory markers may be one way of preventing or managing cancer recurrence in the future as well. So here I just wanted to show you some work that my own group has done, where this is actually a study that was both in cognitive function and fatigue in people with colorectal cancer. But really to emphasise here, this is these three groups are people who have had a diagnosis of cancer and have had surgery but not any chemotherapy yet, and this is a group of people who've not had cancer, so non-cancer controls. And what you can see here is that all of the cancer patients are reporting fatigue at a much higher rate than the healthy controls. And again, these two groups, the black and the pink, it is on my screen, are the groups that subsequently went on to have chemotherapy. So 6 months later, their fatigue levels are much higher and maintained in comparison to the surgery alone group, who are almost back down to a healthy control level, but not quite. So it does seem there is clearly a fatigue response during treatment that is then again sustained in a number of people afterwards. So, and this crazy slide here is actually a picture in that same population of all of the different cytokines that we measured. And really the key thing to sort of explain here is that these high bars are the people who've had diagnosis of cancer, and the lower ones are the people who've had who are in the healthy control group. So essentially what that's showing us is that at baseline and then over time, people who've had a diagnosis of cancer, whether or not they're treated with chemotherapy, have higher cytokine levels, and they seem to remain elevated over time. So again, it's just sort of adding to this picture that perhaps we are seeing people, that cytokines play a role in moderating fatigue over time. So the symptoms that people experience we can manage some of them in different ways, and so the depressed mood, we would be recommending things like cognitive behaviour therapy, which may help people manage their depression. Other psychological therapies that might be useful to different people at different times. Some people would benefit from antidepressants, at least for some period of time, to help them through that. Fatigue, I won't talk very much about this because I know that Carolina is going to cover this in much more detail and much more effectively than I can. But cognitive behaviour therapy and exercise are things that can help with this as well. And insomnia is one of those things that people who are diagnosed with cancer often don't talk about, and it's part of that cluster of symptoms. So things like simple hygiene strategies, sometimes during treatment and afterwards we get into bad sleeping habits, and those are maintained. So challenging some of those with good sleep hygiene is really helpful. And there are definitely programs with short courses of cognitive behaviour therapy that help with that, and short-term use of medication can be helpful, but it's best done in combination with cognitive behaviour therapy. And again, pain is one of those things that's often underreported and can impact on people's sleep and their mood and therefore their fatigue levels as well. So if you have persistent pain in different ways, or even just that sort of feeling that you're not able to stretch enough and those kinds of things, it's a good idea to just look for some support around those things, because they're things where you may need some very simple rehabilitation strategies that might help you to overcome that. But again, it's the evidence base for this is not very clear, so we're doing a lot of work across a lot of different areas to try and bring that up to speed and make sure that we've got good evidence-based strategies to help people. So the other area that Nikki had already mentioned was were cognitive problems. So we know people talk about memory, concentration, planning particularly, and multitasking challenges. So one of the other studies that we have completed in the last couple of years is an online cognitive training program, which is broadly available at brainhq.com, which certainly changed people's perception of their cognitive function. So they felt like they were performing better after they'd done the program over about 12 to 15 weeks. So you can, if cognition is one of the things that's bothering you, then you can go and sign up for that and see if it is helpful for you. So what else can we do about fatigue? As I said earlier, it's an area of ongoing research and people are actively looking at this, and I just wanted to show you this study from which is running in the UK out of the Macmillan Supported Cancer Survivorship Centre at Southampton University, which is called Restore, and it's an online intervention to enhance self-efficacy to manage problems associated with cancer-related fatigue. And what's really interesting about this study is that it's focused on self-efficacy, and so by that we mean what you can do or what you think you can do to change your own life and your own situation. So it's a program which is very structured, but what it's doing is taking the focus of what you can do and what you're able to do as opposed to a deficit kind of approach of what you can't do anymore. And I think that's one of the really interesting shifts that we need to understand much more clearly is, you know, how we help or how we identify whether or not this is a strategy that's helpful for people to actually change the focus slightly. So the table of the sessions that they run in that program is underway, and as I said, it's an ongoing study that's being evaluated. In addition to the structured programs, they also run a series of activities, suggested activities that you can look at as well. So stay tuned. In the next couple of years, hopefully the results of this study will be out and we will know whether it helps or not. And the other thing I think as well, Nikki, you mentioned really managing expectations, particularly, you know, your own expectations and other people's expectations, and I think that was certainly a theme that came through in looking at the questions that people had sent in. That this was an issue that's really quite challenging to communicate to people how it feels, and I think it's about finding a way of trying to have someone empathise with what the situation might be or what it feels like to be in your shoes, and some of us are not very good at doing that. It's challenging, so I don't have any great magic solutions to how to do that, but other than to say it's important and it helps. Seeking support from people, whether that's psychological support or working out what the priorities are. So if, you know, if pacing is really important to you, working out what it is that's important for you to be able to do to help you do that. And there is, I think, some level of acceptance of, you know, that things are not going to go back to being the way that they are, and how are you going to manage with that. And the other key thing really is to stay in touch with all of the new research findings, because there's a lot of people working really hard on this issue to try and to help things and make people's recovery much more effective. And I will stop there.
Thank you. Thanks, Mariana. Over to you, Nikki.
Carolina.
Thanks.
Sorry.
No. So I am an exercise physiologist, and like Nikki said, I work at the fatigue clinic at the University of New South Wales. I'm going to go through a little bit of background stuff, but also just some pragmatic kind of suggestions that actually Nikki and Harry have done really well already. This slide is a little bit about what Harry was talking about before, about how we define cancer-related fatigue. And so I guess everyone gets a bit of a sense it's not just a physical thing where people feel very drained, but it's also a cognitive thing as well, where people have difficulty concentrating. But as an exercise physiologist, a symptom that's quite important to me or interesting is this last symptom at the end here that says post-exertional malaise. And basically what that is when patients or people do a relatively small amount of activity or exercise or physical or cognitive, but then that's followed by a large exacerbation in fatigue and symptoms. It's kind of disproportionate to the activity that they did. So I thought it would be important just to talk about the natural history of fatigue. This is specifically in breast cancer. It kind of links in with the slide that Harry had about colorectal cancer. So this study was a prospective cohort study. So basically they grabbed a group of people who'd had the diagnosis of breast cancer and they followed them up from end of surgery and 12 months after the end of treatment, which would have been end of chemotherapy or radiotherapy. So on the vertical axis are the proportion of people who report disabling fatigue. So what they tried to do in the study is distinguish between feeling, let's say, tired and background fatigue and fatigue that's clinically significant or fatigue that's bad enough that it's really interrupting day-to-day function. And what you can expect is that at the end of treatments, at the end of chemotherapy or radiotherapy, a big proportion of patients are experiencing this bad fatigue. It's about 42% of the cohort. And that's kind of what we would expect. But the good news was that actually by the 3-month mark, the majority of patients' fatigue had resolved. But this tail end of the spectrum where the resolution isn't as sharp is what we would classify, I guess, as post-cancer fatigue, or it's persisting even after treatment has finished. And on top of that, it's what we would call medically unexplained. And so one of the first things that we do when people arrive at our clinic is we engage with their GP and their medical oncologist or surgeon, whoever else they're seeing, and we say thanks for the referral, but also we just want to make sure that what we're going to do with these people is going to be effective, so that the treatment that we're going to prescribe is going to be helpful. And so we just want to make sure that every other thing that could be contributing to fatigue or maybe underlying for the fatigue is managed. So that means there's no thyroid dysfunction or anemia, or that there's not major depression that's causing the fatigue, or a dodgy liver. And so what we need to make sure is that all these boxes have been ticked, and once that's happened, then we call it medically unexplained fatigue, and that's really what our clinic specialises in. I think you've heard about the symptoms quite a bit, and these women have done it a lot better than I will, but I guess what this says is that really it's not just fatigue and not just feeling tired, it's physical, it's mental, there's a sleep component, and then there's also a mood component. So even if depression's not the primary symptom or the primary cause, often what happens is people get frustrated, they aren't able to do what they want to do, or they feel maybe anxious about their symptoms, so it kind of works together, the fatigue and the mood. And what we aim to do in our clinic is basically look at all those different symptoms and symptom clusters and try and manage the symptoms as best as possible. And we do that in a multidisciplinary clinic. So the exercise physiologist works with a clinical psychologist. So every patient that comes in sees both of us. And the purple row at the bottom is basically all the modules that we would deliver, or the kinds of things that we would try and address. So as the exercise physiologist, my focus is primarily on graded exercise therapy and activity pacing. And the psychologist looks at things like mood and anxiety and also sleep. But this is individualised. So even though this is available to all the patients, if someone comes in and they don't have anxiety, then we don't give the anxiety module. It's over 16 weeks, and people come in about 6 to 8 times over that time period. And so this is one of the first things that people see when they come through the clinic, and this just kind of conceptualises the fatigue and how we think about it a little bit better. So the way I think of it is, like Nikki said, we say you've got, let's say, a fuel tank of energy, and all your physical and your cognitive and your emotional activity come out of this tank. And so let's say when you're healthy, there's also always going to be a normal level of fatigue, but usually you go to bed and you wake up the next day and you feel okay. What we think happens in post-cancer fatigue or in fatigue states is that threshold for activity, or that limit, is much lower. So let's say that your new fuel tank is basically where that yellow line is. And people cope probably in a combination of 2 ways. One is this boom-bust cycle that Nikki described really well, where people say they've got good days, they've got bad days, and they try and maybe take advantage of the energy they've got on the good day, but then that leads with a payback and having to compensate the next day. And the other way that people cope is with this activity avoidance, where if every time you go for a run or you read a book you can't concentrate, you go for a run and you feel like rubbish for 4 days, why would you do it again? It's like a protective mechanism. But we know if we do that a lot of the time, then it leads to deconditioning and working underneath your threshold. So what we aim to do at the clinic initially is just try and stabilise those symptoms. So if we can spend comparable amounts of energy day to day, then you should feel consistent day to day. It just adds a bit more predictability to the symptoms and makes people feel like they're in a bit more control of what's happening. And once we've established that baseline level of energy and symptoms, we just slowly start to increase it with graded exercise therapy. So the first thing we'd look at, and these are the kinds of things that you could do yourself, is what are your triggers? What triggers are actually contributing to worsening fatigue? So is it physical, is it cognitive, is it both? Most people would be both, or is it emotional as well? What's your sleep like? Like Harry said, it's incredibly important to try and have regimented sleep as much as possible. And we know that more sleep doesn't necessarily mean less fatigue. And then how does your mood and your fatigue interact? Does one make the other one go down or up, or vice versa? So I tried to, this is one of the things we ask most patients to do. It's quite punishing, but they do really well. And it's a lot of information. Nikki's done many of these. She's done very well. So I think I've blanked it out to try and make it a bit clearer, but one of the first things we'd look at in this diary that we ask people to do is their sleep. So if you can see the green arrows at the top there, basically the things to take from this is in this person's diary, their sleep's not incredibly consistent. Neither are the hours of sleep, but also, say I think it's the Thursday, they have 11 hours sleep, but the rating of quality of sleep is 1. So I guess that means that more sleep doesn't necessarily mean better or less fatigue. The other thing we get people to do is to keep track of their steps, so with a Fitbit or a pedometer or an activity monitor. And so if you look at this day, for example, 10,000 steps, and which you think is doing all right, that's the boom, and then look at the days after, there's the bust. That's a nice kind of clear, more objective way of looking at how people are managing their activities. So this is a mess, but you can ignore most of it. The only thing that I think would be interesting is that this example here where the pink boxes turned up, this just shows the post-exertional exacerbation or post-exertional malaise. So this person's gone to the shops and they've done a ballet class. And the trick is most people feel fine while they're doing the activity, but then it's later that they feel that their fatigue is worse. So in this example, they've had a nap and then they've gone to bed pretty early. So it's all about your reaction to activity. So first thing's all about pacing. Nikki described it really well. One tank of energy, physical, cognitive and emotional take from the same one. And the goal is basically don't run on empty, which is easier said than done, I think. And so one way, like Nikki said, that we do is macro pacing. This is about trying to organise your activities so they're not all on the same day or too many day after the other. And one way to look at this is the step count. And if you can find a safe zone, so a safe number of steps that you can do day to day without having an exacerbation in your fatigue or feeling worse the next day, then that's a really good place to start. And it kind of gives you a bit of an idea of like how many energy dollars, let's say, you've got to spend, at least physically. The other type of pacing that Nikki touched on as well is micro pacing. And this is really about everything that we do, physical or cognitive, has a threshold. So a certain intensity in time that you can do it for before you're going to get an exacerbation or your symptoms get worse. And then the idea is to stick to these thresholds and then have a real, pure, true rest, which are quite tricky to do, but when you do them, they're very helpful. And this is a complete physical and mental rest for at least 15 minutes. So this is an example. You guys can read through them, but I guess, let's say vacuuming is a good example. You know, it's pretty taxing, so it's probably high intensity. In terms of, if you look at the duration of the activity, let's say it might take you 20 minutes. Then you have to ask really, how long should I do this activity for before I get bad symptoms? And that would be your task threshold. And your activity pacing plan would be to do that activity for 10 minutes, so stick to your threshold, and then have a proper break. And then you can go back to it, or you can change to another activity. But the idea is that you're not pushing over that threshold and constantly trying to play catch up. The trick is to stick to the threshold even if you're feeling better on those days. Harry went through the sleep stuff really well. It's all about having good hygiene, avoiding daytime naps, and you know, we've covered on mood as well about maybe seeing a psychologist or planning enjoyable activities. So let's say we've got back to the famous graph. we've got some good activity pacing and we've got some stabilisation in symptoms, then we slowly start to build this up. And this is where the exercise comes in. And we know that exercise is incredibly important, particularly in cancer, but it's all about your reaction to activity. So there's no point in doing an hour walk if then you're on the couch for 4 days afterwards. It's about consistency and being able to gradually increase that. And so the thing that we need to be careful of in fatigue is really this post-exertional exacerbation. So I guess in terms of how you go about this, the first thing I'd recommend is choose something that you like. You know, if you like walking, walk. If you like gardening, garden. If you want to walk around a shopping centre, it's fine. You know, something is good. And choose something that you can do consistently. And we normally would recommend maybe starting 3 days a week on non-consecutive days. So that's that macro pacing again. And then we have to carefully think about what's your threshold. You know, if you're not too sure, you could start at 10 minutes even. And the idea is that how long can you walk for before your symptoms are exacerbated? And then you walk at, say, your 10 minutes for 2 weeks, because it's like a training program. Your body needs to get used to this new activity. And then 2 weeks later, you'd increase this. Now, normally what we'd recommend is increasing the duration. You could also increase the intensity or how many days you walk. But generally, the guidelines are to choose only one thing at a time so that you know what's working and what's not. And we normally recommend something like a 20% increase. So if you're walking 10 minutes, you go up to 12 minutes. And then you do that for 2 to 3 weeks and then increase again. And it's really about trying to stick to a nice plan as much as possible and allowing some flexibility if you're not feeling well one day or you're feeling better another, still stick to the plan. So this is just a little bit about how we would progress it. The goal would be to get to 30 minutes on this, let's say, non-consecutive days. Then you'd start walking on the other days. And then you could start playing around with things like intensity, trying to challenge your system a bit more. And this is where you could maybe add some stairs or walk a bit faster or even do some interval training, which is pretty popular at the moment as well. So this last slide, I really like it because it's just a monitoring tool that we get some of the patients to use. And this is a step count diary. And all it is the letter of the day of the week, and each row represents a whole week. So if you look at kind of the pattern, if you look at, say, Saturday and Sunday, the person's doing quite a lot of steps, around the 8,000 to 10,000 mark. But if you look at the following week, which is the Monday, it's out at less than 1,000 steps. So it's really clear a boom-bust cycle. So then we try and give them a hard time about pacing and try and get people to kind of narrow things in a little bit more. It's not perfect, but actually after a couple of weeks, it's just getting in a little bit neater. And so by taking away the extreme highs, we've also taken away the extreme lows or the extreme need to rest. But the exciting part, I guess, is the trajectory of improvement or slowly starting to get better and doing more. That's the graded exercise component. And why I like this is because it's not perfect. It doesn't fit in a little box. It takes time. Not everyone's diary looks like this. This is true. But it's, I mean, that's the idea of the pacing and then the graded exercise component. This is our clinic if you need to email us or anything like that. Sorry, Jill, taking them out.
Thanks, Carolina. So, gee, we had, I don't know, nearly 800 people register for this webinar and we had so many questions. So it was very hard to pick out just a handful of questions. We're not sure what we're going to do with all the other questions, but I hope a lot of them have been answered. And I think a lot of them have been answered in the discussion so far. So we'll go through question by question. I normally sort of read it out and whoever wants to answer it or talk about it, have a bit of a discussion. So the first one, again, it's talking about that stress and the emotions that come into it. So how much of the fatigue is caused by the stress of the situation and the emotional distress regarding the impact on the lives of the families as well, because we haven't really talked about the impact on the families as such. So very, again, subjective. So it's a very hard one to...
You're looking at me?
I think so, psychologist.
Okay. Well, I mean, I think that the situations that people find themselves in after, with a diagnosis of cancer and then throughout the treatment can, are very highly stressful, and it certainly impacts on all of the people around them and close to them as well. But I guess what you find is that most people will find a way of dealing with that on an everyday basis. And I think particularly when you're going through treatment, it's stressful, but having something to do that you're required to do that is contributing to managing your cancer is one of the things that actually helps that to sort of dissipate. And once you've kind of gotten over the initial stress and shock of the diagnosis and the treatments, then people tend to sort of settle into a relatively stable pattern with that. What I think is really interesting, though, is kind of coming back to that, the sort of the things that I was talking about earlier in terms of the cytokine response, so that inflammatory response, which appears to be related to the tumour, but it has those other components to it as well, that if that's still there and part of that system, it's feeding into it, an ongoing cycle. And some of the treatments that people are on, it's definitely having a response, having a sort of chicken and egg response to that. So it is making it worse, and it may actually sometimes, and it may mean that it's going to be around longer, but I think there are also a lot of individual responses in that situation. So we know that people respond differently to stress anyway. So predicting what that's going to be like is challenging, and why people respond in different ways we don't really understand very well. So I don't know if that addresses the question, but I have.
It's a difficult question to answer, I think. Yeah. I think, as you said, if you're having these emotional issues, probably some psychological help or some counselling or something.
Yeah. Just to even adjust or get over that initial stress response could be quite helpful. Yeah.
The next one, could you please explain the relationship between physical and mental fatigue?
Right. I guess I know we said it a little bit before, but really we work on the concept that there's one tank of energy. And I think the one that you can add in there on top as well is the emotional activity, at least. And I would say, from my experience at least, most people are equally affected by physical activity and cognitive, but definitely the biggest taker of energy is the emotional. So as soon as, like, for example, if someone comes into the clinic and they're very anxious about whatever, that's the first thing that our psychologist would work on, because it just kind of cuts your tank in half, really, and for anyone, whether you've got fatigue or you don't. But then once we've subsided that emotional component, then it's really about trying to find that balance between the physical and cognitive. So an example is actually when we have uni students who have fatigue, if there are days that they're going to uni, that's a more cognitively stressful day or straining day, then we ask them for their step counts to be lower so that they can compensate between the two types of activity. So I think they're very interlinked.
I mean, I think that one of the things that I would just add to that is that we have this kind of idea of the mind and the body being kind of separate, but we're a whole system, and what happens and and I think the more we understand about our biology, that becomes clearer, that what happens peripherally in the body impacts on the brain as well. So it very much supports that idea of we've got this this limited amount of resource that needs to be expended carefully.
That's all. I've been going back to the first question about the stress.
Yeah.
And then this one, it's all interlinked. So you've got to manage, as you say, manage the emotional and then start working on the physical a bit more.
Which is the hardest bit, I think, the emotional bit. But actually that's when you can get a lot of support and a lot of great psychologists out there that can really help with that. You don't have to be specialised in fatigue per se. It's good.
And I'm sure there's going to be people sitting there going, well, lucky for people in Sydney, there's a fatigue clinic. So if people in other states and other cities, what would you suggest? What can they do? I guess they can go and see a psychologist. Or they can go and see an exercise physiologist. It doesn't have to be a clinic.
No, absolutely not. And actually there's a lot of people, that work rurally that actually there might be two, like an independent psychologist, an independent physiotherapist or exercise physiologist, and they just communicate well and they manage that same patient. I think what's key though is, like Harry said, it's kind of just now starting to understand really what fatigue is. And at uni, for example, you don't really get taught how to exercise with people who have fatigue. So I think that would be the only thing. It's about knowing what works for your body, you know, and what works for you, and but using that support network that you have around you and those resources that can be wonderful.
And I think the other thing that I would add to that is that if you are somewhere where you can't find someone that's got specialist skills in this kind of area, then talk to them about what they're willing to do. And I think all of us who work in this area are very happy to be contacted and mentor people who are seeing patients in the community and might need a bit of support to do that more effectively.
We've actually got a trial running at the moment that is about clinician education about fatigue states. So really trying to educate allied health professionals about how to best manage this, and that's for psychologists, physiotherapists, exercise physiologists, and that's just online and it's free. So the idea is to try and get the information out there so that people don't have to wait 5 months to get into the clinic or travel to Sydney.
We can share that in the resources because there are a lot of health professionals that have registered, so we can bring that information, share that information out. Apparently you and I aren't speaking loud enough.
Sorry.
I'm going to speak up a little bit. So the next one, why is some fatigue gradual whilst other is the hit the wall type, which I think you kind of addressed when, you know, talking about the empty tank. Is that maybe to do with that one?
I mean, I guess it depends. The way I interpret this question, maybe Nikki, you could interpret it a bit differently, is sometimes I think you just hit the wall a bit sooner because either you allow yourself to understand what's going on in your body, so you actually stop. So often when we ask people to stop initially and take a break, they go, your breaks are making me worse. Your breaks are making me feel like rubbish. Actually, you're just breaking too late. You're stopping too late. You're stopping past your threshold. Whereas the gradual, this is the way I interpret it, at least the gradual might be more about it's Friday, I'm feeling much worse than I was on Monday. And that could be because you've had work all week actually and you've just passed your threshold from day to day.
I agree.
Because that was another question that was popping up on the chat box earlier about people that they work and do they come home and have, you know, that 20-minute cat nap that we talk about and then maybe, so come home, have a nap and then do dinner or whatever they have to do and then go to bed at 10:30, or should they just keep going and go to bed at 7 o'clock? You know, maybe Nikki.
What do you reckon, Nikki?
It's definitely not a nap. If you sleep during the day, that makes my sleep worse at night. It's a rest. So it's, for me, it's the eye bag on, the relaxation music, no one talking to me, no TV, no screen. And you can rest for 20 minutes and then do your dinner. But I would definitely not recommend
sleep, just rest.
Not asleep, because then you can't sleep at night and then that just sets you in a really bad sleeping pattern. Would you agree?
Yeah, that's generally the sleep hygiene rules.
But it sounds like the key is actually the proper rest, not just sort of, it's not lying down and reading a book or looking at your phone, it's actually resting.
Disengaging.
Yeah, absolutely.
So the next question about diet, and again in the chat box there was conversation about weight gain and not feeling like cooking because they're too tired, so maybe eating junk food instead of having health food because they're too tired to shop and prepare and do all that. Sometimes it's an effort, I guess, which kind of links in with this question about diet making dealing with fatigue. So we don't have a nutritionist here, but I guess.
I think, you know, in our experience with working with people well after, you know, they've finished treatment, then weight gain is a problem, and it's. Yeah, you know, I guess it's really back to that question about what you can achieve and how to plan for that effectively. So it could be that, you know, looking at your pacing on days when you can do it, you do, or you have a day of the week where perhaps maybe you do prepare meals and freeze them or things like that. So you're just trying to make it easy for yourself, but it does require, you know, the energy to plan.
There's heaps of resources now, like that there are foods that either get delivered straight to you that they're not frozen, they're fresh. And initially it just takes a bit of the burden off people just to be able to order it online, and people get a bit worried, you know, is it fresh or is it, you know, and usually actually it's pretty good quality, and at least you can even say just for a month. I'm just going to give myself a break for a month to get myself a bit organised or try and get this pacing underway, gets delivered to your door, or you can freeze meals. Like, otherwise cooking in big batches is always an option as well, but that takes time and planning and a lot of energy.
So with me, I ate really badly throughout the whole cancer journey. I just ate cake because I was feeling so bad I wanted cake, and that cheered me up. But and then afterwards I had a couple of years where I still ate pretty badly, but in the last couple of years I've completely changed my diet and lost weight, and I'm just eating a lot more healthier now. But I don't think that's actually made a dent into my fatigue. It makes me feel psychologically better, and I feel great because I'm eating healthier. But in terms of the fatigue, I haven't actually found any difference in terms of the way that I feel, that it's not weight related or diet related for me.
Yeah.
You know, so, I mean, yes, by all means, I'm not saying eat junk food, but, you know, eat healthy. And some of the ways that I do that is by making sure that I have healthy food in the house. So I'll do the packaged salads, you know, and that kind of thing, and stuff that I can assemble rather than I actually have to cook. And that's great in summertime because, you know, it's quite easy to make a salad rather than having anything else. But for me, sorry, the diet hasn't made a difference to fatigue.
Okay. Now, supporting someone with fatigue. So there may be, you know, family members and what have you here listening tonight, and what can they do to support their partner or friend or whatever that has fatigue? What
have you found that, you know?
Yeah.
Anything?
Oh, I don't know. I think it's just being patient with people, because it just goes on for such a long time, and it's not something that's an easy fix. You know, it's not like you're in treatment and you're on that cycle and then, you know, your next chemo's up and so everyone's there to support you and everything. Once the fatigue sets in, like it did for me, there's not a lot you can do. And I don't know, I mean, I'm terrible with my family, and, you know, like, I just get really frustrated and they get frustrated with me because it's such a difficult condition to sort of come to grips with, and I don't have a lot of advice, sorry.
So what is it that you would want them to be for you or say?
Just more understanding, I think, you know, and, you know, and I'm cranky a lot of the time, so, and I do snap, and I just, you know, and after I do that, especially to my nephew, I just have to always, you know, when I'm feeling better, I come back and I say, look, it's just the fatigue, you know, it's not you, it's the fatigue. So I think just a level of understanding, and I think because it's not widely known in the community, that the more education, the more things like this that people can listen to and understand that it is, you know, it is a condition. It's not that someone's, you know, lacking in motivation to try and get better or that they're lazy. It's just that this impacts you. It impacts your whole, the way that you look at your whole life. Does that make sense?
Yeah, totally agree.
Sorry, we're at the end of the hour and I'm a bit tired.
Okay, that's all right.
Go into it.
Well, that's the last question, and there's probably a few, what's the email for the fatigue clinic? Well, we'll share that with you. So that was on the slide though. I guess just one last thing that has came up kind of a lot, it was the long-term people, 10 years plus, 5 years, and they still experience this fatigue. I guess it just has to be investigated as to what it's about.
I think so. I think it's one of those things that has gone under-recognised and therefore undertreated because we haven't understood it as an independent condition. We still, you know, are fairly early on in understanding what actually is helpful. So there are things that are helpful, but we don't really have a good handle on how long that's going to take for an individual either. So there's a lot of things that are unclear, and I think there's also the component of we're only just really starting to understand the individual differences in response to treatment actually. So you know, one person may have a very straightforward process through one, you know, particular treatment that somebody finds quite debilitating and causes them long-term symptoms of fatigue. And so I think that's where, you know, we've kind of had this very intense way of treating cancer and then not really understanding the longer term consequences of some of those sorts of things. So I think, I don't have any magic solutions, but I do think it's being much more aware and more proactive about saying to health professionals, this is really a problem for me and I would like to, you know, I would like to investigate further if there is something that I can do in order to try and address that more effectively. And I think if I can just also add, because I remember reading through, there were a lot of questions about immunotherapies like Keytruda and nivolumab and things like that. So because they are immunotherapies, they do impact on your immune system, so you do get fatigue that's related to the treatment, and I think these drugs are all really new and we don't understand very much about that experience or the the trajectory of that, or what happens to people who are on those treatments long term. So again, that's an area of active research that people are engaged in, but we don't have very many answers or solutions to that particular problem at the moment.
And again, in the questions, there was a lot getting that blank stare from the health professional when they say,
Send them to Carolina.
This is a big problem and it's real and all these things, and whoever it is sitting across from them, whether it's the GP oncologist, whoever, because it's only sort of starting to get recognised a bit more. And I guess the message is be proactive and say, this is real.
I think, and there's so many things that can cause fatigue, right? It's not just cancer. And so I think being properly investigated should be number one.
Yeah.
Yeah, and actually during our waiting list, that's what we get people to do.
Yeah.
Because there's no point waiting if there's other things that you could be doing. Actually, a lot of people have thyroid dysfunction, and just by my experience, and that just needs a pill. Yeah. Just the medication, actually, that improves fatigue a lot. But then there's obviously that medically unexplained fatigue. So I'd push, basically. And if you don't feel right, just push them.
Go investigate it. Go and talk to your GP. Get a referral and get it investigated, I guess.
Yeah.
And if you're in Sydney,
go
to Carolina. So those are the questions. So we have one last slide. We don't seem to be moving. I'm just trying to move to the final slide.
No final slide.
No final slide.
No final slide. It dropped off and I added it back on and it doesn't seem to be there. So if you have any queries, our 13 11 20 phone number, it's national. So if you have any questions that you want to ask someone tomorrow between 9 and 5, all the cancer councils, please call. Again, if there's anything that's come up for you during this presentation and you'd like to speak to somebody tonight, ring Lifeline 13 11 14. That's 24 hours a day, 7 days a week. Also mentioning, which was also in the chat box, we have Cancer Council has a new online community, and if you just go to our website and type in online community, you can get linked up, and there's blogs and forums and private groups and all sorts of things. So it's just been relaunched. Go and have a look at that. Thank you all. There will be a questionnaire popping up, so would love you to answer. Takes you a couple of minutes, not many questions. Just want to know whether we've been helpful tonight and to help us inform our future webinars. So thank you to the panel. Thank you, Nikki, and Hariana and Carolina. It was really great, and I hope you all enjoyed it, and hopefully see you next time. Thanks very much.